The following video demonstrates the general guidelines on how to set up your rectal insufflation kit. The general consensus relating to rectal insufflation is based on a dosage twice that of the clinical ozone treatment, major autohemotherapy, which is based on a 1:1 ratio, where 100 ml of blood is drawn from a patient and is mixed with 100 ml of ozone gas. So when performing rectal insufflations, it is recommended to do twice the amount of ozone gas per treatment to gain a similar systematic dosage. Furthermore, the absorption efficiency of general medication which is administered rectally is based on a 1:2 ratio, meaning only 50% of the medication will be effective. For example, here is a document written by G. Martinez Sanchez regarding rectal administration of ozone gas. Here, the document suggests a recommended volume of 200 ml. However, Part 2 of the document recommends a starting volume of 100 ml, within an ozone concentration range of 10 to 20 micrograms per milliliter. In Part 2 of the document, a suggestion is made not to exceed a 300 ml volume per treatment. However, this is only a precautionary measure. If you feel you require a larger volume than 300 ml per treatment, you can adjust the volume to an amount you feel comfortable with. Further on in this video, we will discuss the recommended ozone concentrations relating to applications. Here is a posterior view of the rectum. The rectum has a substantial blood supply coming from multiple sources. Rectal administration uses the rectum as a route of administration for medication and other fluids, which are absorbed by the rectum's blood vessels and flow into the body's circulatory system, which distributes the ozonides around the body. When ozone is administered into the rectal epithelium cells are the transport route into the blood vessel capillaries. The rectal epithelium cells sit below the rectal mucosa. The absorption takes place through these cells into the enterocytes. The enterocytes connect to the blood vessel capillaries for distribution around the body. The range of dose is 10 to 35 micrograms per milliliter. The range of volume is 200 to 300 ml per treatment. Concentrations higher than 40 micrograms per milliliter may hurt the enterocyte cells.
Okay, so for the sake of the demonstration, you'll remove your 200 ml bulb from the package. It will be measured at 200 milliliters. For rectal insufflations, always 200 milliliters, which is a 1:2 ratio on a clinical treatment called major autohemotherapy, which is a 1:1 ratio. So, to give you an example, they will remove, or a practitioner will remove 100 milliliters of blood from the patient and infuse the ozone gas at 100 milliliters. So it's a 1:1 ratio. But when doing rectal insufflations, it is advised to do twice that amount to have a similar biological and systemic effect. Okay, so once you receive the bulb, you'll see a cap on the top. The cap is a Lurlock male cap. You just remove that cap, it will stay on. This is a Lurlock connector, and this is not a Lurlock connector. This connector will be identified or indicated with a blue polycarbonate male Lurlock when you receive, which will be this. This tubing is the tubing that will connect for the rectum, okay? So you will just twist this on the top, like so. Make sure it's nice and tight. On the other end of this tubing will be a catheter, okay? The catheters are removable and are designed to be disposable after every treatment. On the other side of the bulb there is another connector another tubing will connect to this, which will be through pressure. It will just slide on top. The tubing won't come off. It's quite tight. And the tubing is platinum cured silicon, okay? So it will not react with the ozone. Its oxidation potential, ozone cannot break down this this silicon as it's platinum cured. So it will last a lot longer than any peroxide cured silicon tubing that will react. It will turn the tube cloudy, okay? If you see that, dispose of the tubing, okay? So that is the rectal insufflation bulb setup. So first, we want to fill a 200 ml polyvinyl chloride bag, okay? These bags should be replaced every 20 treatments. The material is grade B. How we do this is to connect onto a stopcock, a polycarbonate stopcock. If the stopcock is directing this way instead of this way, that is a direct flow through, okay? So I'm going to select 20 micrograms at half a litre a minute. I'm going to fill the bag. Once the bag is full, you can either use this pinch clip to push to seal the bag, or use this stopcock and turn 90 degrees to seal. But the bag is getting full pretty quickly, so I can sort of turn off this flow now. Turn that. Okay. Can then remove this tubing. You don't have to use it directly from a generator. You can use it as from a humidifier if you would like to do so. There will be another demonstration in regards to humidifying the ozone through the glassware over there. But for this demonstration, we'll just keep it specific to rectal insufflation. Okay. With the bulb, you will now connect this tubing to the bag via Lerlock connection, like so. You will then open this, so all the ozone can be funneled through the bag into the bulb, okay? First thing we want to do though is flush all the air out of the bulb, so only ozone is left in the lines of the tubing, okay? So there'll be no nitrogen left in there. And how we do this is we connect the catheter end, I've just removed that, onto the ozone struct, which will create a circle, like a system where the ozone gas will go through the bulb, through the ozone destruct, and just circle that way, okay? I generally do 2 flushes, so it will be 1 push of all the air into the ozone destruct. I will then release the bulb, and that sound tells me the ozone has been sucked from the bag into the bulb perfectly measured at 200 mil. I will then do another push into the destruct and then release. And then the bulb is full of ozone at 20 micrograms, perfectly measured at 200 mil. I will then release the tube and connect the catheter, which will then be inserted into the rectum. I will then do one push, slowly altering the pressure of the rate of which the ozone goes into the rectum. If you do too quick, it can be quite painful. So sort of work out the pressure that you require, and the moment that you've done the 200 mil, you can just release the bulb and it will fill from the bag. Thank you.